Hi,
Hi
good afternoon.
everyone. Hi ma'am.
Hi,
Go ahead.
good afternoon, everyone. And Michelle, you just let people in, okay, if anybody else is coming.
Yes. Yeah.
All right. So thank you so much for joining on a weekend and on an afternoon. And so today I'm going to be talking about integrative approach in rheumatoid arthritis. And Michelle was telling me that most of the people who are interested in joining this are already suffering from RA or working with people who are suffering from RA in some way or the other. So I hope that this gives you some insight into what we can do from a holistic or an integrative perspective in RA cases. And please, if you have any questions, put it up on the chat. If it's relevant, I can, answer it then and there, so that, we don't have to wait till the end of the discussion for it. So I'll just share my screen quickly. Michelle, you can see my screen. Can you guys see my screen?
Sorry, ma'am was muted. We can see your screen, ma'am. You can just maybe make it full screen
Yeah.
when you're starting to present.
All right. So, when working with rheumatoid arthritis, I think you guys must have heard this term identifying the root cause of your problem. So, what is the root cause of RA? Does anybody know? Does science know? Do we exactly know? Unfortunately, the answer is no. So, there are multiple factors that can lead to the development of rheumatoid arthritis. Now, what is it exactly? So, it is a disease in which the body starts developing antibodies against against the joint cartilage, which causes a lot of destruction and can lead to inflammatory symptoms like there is swelling, there is destruction of the joint, there is muscle wasting, a lot of things eventually leading to permanent disfigurement in some cases. So this is considered in medical science, it is considered as an autoimmune progressive condition which doesn't have a cure. So that is what in today's world we know RA as. So again, let's come back to how do we identify the root cause. Now, if I think about the RA cases that I have seen so far in my practice, they usually present, certain aggravating factors, you can say, like certain factors which precipitated the first attack of rheumatoid arthritis. One very commonly what we see is viral and bacterial infections, like somebody who has suffered from dengue or chikungunya or some viral diseases like that, and then it leads to post viral arthralgia, and eventually it is leading to rheumatoid arthritis. This has been observed. Second, what I observe is there is usually a precipitating element of extreme stress. So it could be one particular reason or it could be multiple reasons that are causing the stress. The third factor which I have observed is lifestyle. So if someone is, let's say, working on night shifts for years together or months together, and suddenly they develop RA symptoms, and we do see that particular correlation. And fourth, and probably the most important factor is being a woman. Yes. So RA is much more common in women than men by almost 4 or 5 times. So just by the fact that you are a woman, you are having hormonal imbalances, you are either going through puberty or you're going through menopause or it is post your pregnancy delivery, it can lead to development of rheumatoid arthritis. So there are multiple root causes as we can see. So when someone comes to me, I take their entire history. Even in their history, there is usually one major cause and multiple minor causes, and these causes are different for different people. Okay, so you cannot say for sure that this is what always leads to RA, which is why the medical science is also not very decided that okay, this could be a root cause of RA. And apart from all these environmental factors, stress factors, lifestyle factors, there's also something called as genetics, which plays a role in development of RA. So in any case, it is important to understand the root cause, yes, so that we can address it accordingly. Now, the first line of treatment that most of the rheumatologists give is DMARDs, which is disease modifying anti rheumatic drugs. Now, what are these exactly? Okay, so I'm just going to talk. These are drugs that basically reduce certain inflammatory markers in the body, which are known to cause joint destructions and which are increased in RA patients. So these could be biologicals, which is a particular molecule which attacks a particular enzyme, like something which is attacking interleukin 6, something which is attacking COX-2. Okay, these are particular molecules. And then there are non-biologicals, something like methotrexate, which is generally working on the immunity of the person, and it reduces the immune hyperactivity so that it reduces the autoimmune reactions. Now, what you have to remember is that in when we call somebody as what do you say, RA positive rheumatoid arthritis patient, it means that they have something called as rheumatoid factor antibodies which are present in their body. Now, none of these drugs, the DMARDs or the painkillers or whatever the conventional line of treatment is, none of these drugs actually reduce the antibody levels. What they do is they control the inflammatory markers. They reduce the pain, they reduce the inflammation, they reduce the molecules that are causing the destruction. So, thereby, in the long run, it protects the joints, yes, but it has no effect on the RA factor. RA factor reduces, increases on its own. So when let's say somebody's RA factor suddenly becomes zero, then they say that the person has gone into spontaneous remission. We don't know why, but the person has gone into spontaneous remission. And it does happen. So we do see that when the person is out of the extremely stressful phase, or the person had a post-viral RA, they took treatment for a few months and then it completely subsided because the body's hyperactivity went down, hyperimmunogenicity went down. So we do see that as well. So spontaneous remissions are part of the prognosis or the process in which RA works. Okay. Now, I'll share one small. Yeah. So this is how the DMARDs works, or the disease modifying drugs works. But we will also see that root cause therapy may not always work. So if you look into alternative approaches or functional medicine approaches, they all talk about identifying the root cause of RA. And if you work on the root cause of RA, the RA will get reversed. In some cases, yes, but in some cases, it does not work. And the reason that happens is because whatever has caused the autoimmunity to start, it has progressed to such an extent that just reversing the cause does not reverse the pathology of the disease. So we have to work harder to reverse the pathology of the disease. Now, what is the pathology of the disease? Now, in simple terms, very, very simple terms, that all these, antibodies causing destruction, so all these releases something called as oxidative stress in our body. So it causes a lot of negative radicals which are released, which leads to something called as oxidative stress. So when this happens, your body has to use all the antioxidants which it naturally has, also which you are taking externally through food, through supplements, etc., to counter that oxidative stress. All right. And the DMARDs that you're taking, the disease modifying drugs that you're taking, also work partly on reducing this oxidative stress. Okay. Now, why this is important to understand is because all of this integrative therapy that we are looking into, it works against this oxidative stress. It reduces the oxidative load in the body, then which gradually reduces the inflammation, and then that spontaneously puts the person in remission. So this is what we are looking at. if 10 years down the line, a person who has gone into remission is again presented with severe stress, has produced a lot of oxidative damage in the body, there is a chance that the person might again go into RA symptoms. So this is something that you have to keep in mind, that this is always an up and down process when it comes to any autoimmune condition. All right. I hope everyone has understood this. If you have any questions, please put them in the chat box. Okay. So now we'll elaborate a little bit more on this antioxidants and this oxidative stress so that we understand how we can use it in the treatment process. So what increases the oxidative stress? Now, let me tell you, to be very frank, even breathing causes oxidative stress in the body. The mere fact that you're breathing in oxygen and giving out carbon dioxide, it releases free radicals in the body, which can potentially damage your organs, your arteries, your veins, etc. But we don't experience that damage because our body has enough antioxidants to counteract that oxidative stress. It is a minor oxidative stress. The other things which can cause oxidative stress is pollution, big time, big time. Second is exposure to toxic heavy metals. Like now we are seeing there's a lot of heavy metal like lead, arsenic, mercury that we are being exposed through, to either through food or through environmental sources. That can lead to oxidative stress. Third, and probably one of the most important factors, is stress. Any form of severe stress can lead to oxidative stress in our body, because whether it be mental or physical, stress is stress. It releases free radicals. This is the third most important thing. Fourth most important thing is diet. So whatever we are eating, so if we are eating foods that are processed, that are rich in sugar, that is has not really made up of real things, it's all artificial things, artificial colors, artificial flavors, etc., etc. These gradually add up into our oxidative stress pile, which is why when certain patients, when they go into a gluten-free, dairy-free, it's called as AIP, which is autoimmune protocol, which is an anti-inflammatory diet. When you start that, they suddenly see a huge difference in their symptoms. The main reason being that the overall oxidative stress of the body starts going down when they start doing this kind of diet. Okay, so diet is another big thing. Then is lifestyle. So if your sleep pattern is not regular, you're not getting enough exposure to the sun, you're not doing enough movement, exercise, you are not having enough, I would say, mental well-being, like having a good uh, close group of people around you, friends, family, having a supportive work environment. So all these things add up to what we call as oxidative stress. So when all these things are high, and on top of that, your body is producing auto antibodies against your own joints, can you imagine how much the body has to produce antioxidants to fight that? Because there is already underlying oxidative stress which is very high. So whatever you take, it will be insufficient to stop this autoimmune response. Okay. So where to start? Now, this is the question. So we have discussed. So I'm sure that everybody knows the basics about RA over here. So I am not getting into details. Okay. But the question here is, where do you start? Because as I said, everything can lead to oxidative stress. So the next question will be, what do I do? Should I stop breathing? Should I stop living? No. Okay. There is a way to start. So first step is to correct the correctable. To correct the sleep. Sleep is a huge factor which leads to healing of the body. So making sure you're getting 6 to 8 hours of sleep in the night according to the circadian rhythm of your body. If that is not possible, then fix the circadian rhythm of your body and then make sure you're getting good quality and quantity of sleep. All right. Then there is movement, exercise, any form of exercise to begin with. All right. And I'm not saying exercise when the RA pain is very high. When there is a lot of swelling, there is a lot of pain, please refrain from doing physiotherapy and exercise and all that. It is not recommended. But after the acute phase is passed, movement or exercise in any form. So it could be swimming, it could be Pilates, it could be resistance training, it could be yoga, it could be whatever your body is able to do, depending on the condition, it will still add to the antioxidant effect in your body. Then, as I discussed, food and nutrition. Now, when you talk about diet, there is a huge amount of controversy in every diet that I'll be telling. But what I generally follow in my practice, that is what I'll tell you. Basic principles, like I said, not having processed food, like not having foods that are made in the factories, first thing, not having refined carbs, refined sugar, switch to more complex starch like whole grains, lot of vegetables, lot of fruits because they have a lot of antioxidants in them even naturally. And at least try to get 12 to 14 hours of fasting on a regular basis, something called as intermittent fasting. So these are basic food principles which anybody can follow irrespective of the diet. And once that is achieved, and then you add on other things because there are some people who are very sensitive to dairy. So when they eliminate dairy from their diet, they get huge relief in their symptoms. There are some people who are sensitive to gluten, that is the wheat protein. So eliminating wheat again will give them huge relief in symptoms. But these are not 100% or universally applicable. There are some people who get benefit out of it. There are some who don't. So we have to understand where this can be helpful and where it will not be really helpful. The fourth and the most important thing is correcting deficiencies. Now, this I feel is like a chicken and egg issue. Whether the deficiencies are leading to RA or because of the RA and the heightened inflammation in the body, your body is using up some basic nutrients like B12, vitamin D. So these are antioxidants even naturally. So your body has to use more of these to overcome the oxidative stress. So because of that, when a person is suffering from such a disease, they end up in deficiencies naturally because you cannot compensate for these things just by increasing your dietary intake. So working on it specifically will help to reduce the inflammation. Now, next is climate or weather. So now this there is no medically recognized thing that in cold climates RA is more or hotter climates RA is less. Nothing of that sort. But people have reported or participants in studies have reported that there is the experience of pain is more when the cold is higher, when the temperatures are lower. So making sure that you're keeping yourself warm or moving to an area which has a little bit more moderate weather rather than colder weathers may help you reduce the inflammation. Third, as I said, stress is one of the most important aspects that I feel that contributes to any autoimmune disease. So whenever I talk to my patients, I always ask them, what is the stress that you're undergoing, and it comes up in the consultation also. So how can we work on that? That is my first question. So this is where one very important technique that works is cognitive behavioral therapy. So understanding the emotions which trigger the sympathetic response in your body and dealing with those emotions. There are multiple ways of doing this. So you can do it through meditation, you can do it through chanting, you can do it through EFT, you can do it through color therapy, art therapy, movement therapy, whatever suits you, whatever works for you, whatever resonates with you, you can do that to make sure that you're able to manage your emotions the right way. It's not the emotions that create the problem, but the effect those emotions have on our body without our knowledge. It's subconscious. These things that happen, they don't happen at a conscious level, they happen at a very subconscious level. So even if you feel that, okay, you're not stressed, your body might feel different. So understanding that, communicating with your body and understanding where your body is at becomes very, very, very important, especially in cases that are not resolved by doing medications, by doing these alternative therapies, by doing supplements, and they still feel that there is a roadblock. This could be the roadblock that we are looking at. And then, as I said, sometimes without doing anything, also somebody goes into spontaneous remission. Is it possible? Yes, it is very much possible because suddenly something shifts in the circuitry of the body and the cells that are autoimmune they disappear. The mutation that caused these cells to happen in the first place, the mutation is not there anymore, and the person goes into remission. So maybe something the person did without his or her knowledge, without understanding, but ho gaya, and they go into remission. It is completely possible. But do remember that even after you go into remission, maintenance is very, very important. And then lastly, as I said, supplements. So the common supplements that we see in any autoimmune cases, especially for RA, I would say, we'll get to that a little bit later, but just to mention them is vitamin D3, K2, magnesium, glucosamine. This I use quite frequently. Then zinc, vitamin C, and acetylcysteine. So these are few supplements which I commonly give to reduce the inflammation in the body and also to overcome the deficiencies that might be there. A more pragmatic approach would be to test for deficiencies before starting on any supplements like this. But the tests sometimes get expensive and it's not easy to test for all deficiencies. So I would say it's a clinical call to say that, okay, I think, we can do these supplements for you. And B complex, of course, B1, B6, and B12. CBD oil is again a wonderful tool to have to reduce inflammation. And in long term, it has shown to also reduce the damage that the joints have. So it reduces the damage gradually, it repairs the cartilages of the damaged joints, and it gradually reduces the autoimmune response of the body too. So this is a great add-on. And I feel anybody who is taking CBD oil should take it regularly for minimum 9 to 12 months before deciding to pause it. Because it takes that much time for the body to have the immune modulation and give that, effect. The next therapy, I think this is something that I thought I would talk about today, is intravenous therapy. Now, intravenous therapy is nothing but the therapy in which you are injecting nutrients or supplements directly into your veins. Now, the reason why this started was most of these supplements which we see, vitamin C, N-acetylcysteine, magnesium, all these supplements have very, very low glutathione. They have a very low bioavailability when you take it orally. So whatever you're taking, let's say you're taking 500 mg orally, out of it only 10% is absorbed to your digestive system. After that, it goes to the first pass metabolism in the liver. So ultimately, what you're getting is a minuscule amount of actually how much you're consuming. So the IV therapy, what it does, it bypasses this entire oral issue and the bioavailability becomes very high, and you can give concentrated amount to the patient, and the effects are almost instantaneous in terms of antioxidant efficacy. So efficacy of these antioxidants are almost instantaneous. We can see that there is immediate boost in energy levels. You can see immediately there is a glow in their face, and all these things start happening. So IV therapy is something that can be added on to whatever you're doing if in case you have hit a roadblock, as I said. So again, what it does is increases your antioxidant capacity of the body and thereby gradually reduces the inflammation. You can do this like a maintenance therapy. You can do it once in a week. You can do it once in a month. Even if you take once in 3 months, that one dose will do the effect that it does. And you can, maintain it that with oral, whatever you're taking orally. Now, next is ozone therapy. I think some of you wanted to know more about ozone therapy, what it does. So, ozone therapy is nothing but using the gas ozone, which is O3, to do the same. That is the antioxidant effect. So, when ozone is brought into our body either through your nasal route or oral route or rectal route or vaginal route. So, however, you're putting ozone in your body, what it does is it splits into O2, which is oxygen, and O radical. And that O radical, it behaves as an antioxidant. So, it also increases your antioxidant load of the body. So, ozone therapy is also a great add on that you can do, which reduces the joint swelling, it reduces pain, it increases uh, the antioxidant load in the body and reduces the autoimmune response of the body. Okay. Now, these are some of the supplements that I like to use because they help. They have shown to help very much in RA cases. So, the first one is green tea extract. It has a lot of research behind it. which has EGCG. It's a very long name. I'm not getting into that. But the higher concentration of EGCG, higher the antioxidant benefit that you get. This is another plant whose root extract is being used. It's also called as, I forgot the colloquial name. It's called something, I forgot. But it's not very, very easily available. There are a couple of brands that make it and sell it in India. So you can get that used. Curcumin and boswellia, these are my to go supplements which I give. And boswellia, I you can also do higher concentrations like 1500 a day also helps, especially in acute phase, where the pain is very high. And curcumin also you can do from somewhere around 1000 to 1500 easily mg in a day, which has very high anti-inflammatory properties. Borage oil is also another anti-inflammatory oil which works very well. I use it in even women with hormonal issues, and it has got good results. So this can be added on as well. And as I suggested before, vitamin D3 and vitamin C, which are anyway, they are deficient or they become deficient in the process of RA, and then they can be given. And glutathione is one of the strongest antioxidants that there is. The only disadvantage is that it is a little expensive. So it's not very affordable for everyone, and orally, when you take glutathione, the bioavailability is very, 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 very poor. Like it almost doesn't work. But people still try to take it because it is cheaper than getting the IV done. The IV goes a little expensive. But if you are able to access that, then this is a wonderful antioxidant that that can help you reduce the symptoms. So I think I've talked a lot about intravenous therapies and ozone therapies. So I'm going to stop the presentation here, and we can be open to discussion and we can talk about your questions as well.
Madam, Akshay here.
Yes, Dr. Akshay.
Selenium.
Yes, yes, selenium. I saw. But there are so many things, no, Dr. Akshay.
No, I help